All right, today we're going to dive into chronic pain from an angle that, well, you've probably never even thought of. We're looking at an approach that says, to figure out what's wrong with your back, you might need to start by looking in your mouth.
I mean, it's a strange question, isn't it? Let's say you're dealing with sciatica, or maybe some nagging shoulder pain. The absolute last thing you expect a specialist to bring up is your dental history. But it turns out that one single question is the key to unlocking a much, much deeper way of understanding why we hurt. And this is exactly where our source expert, Jadranka Perl, gets started. Now, she's a licensed acupuncturist and a sports medicine specialist, and her investigation into chronic pain begins by following clues that, honestly, most other practitioners just completely miss. This quote really gets right to the heart of it. What she's arguing is that procedures like root canals can create this kind of low-grade simmering inflammation. And while you might think, okay, so what? It's actually based on a really simple but powerful principle about how our bodies are wired.
And that's the crucial point right there. Your body isn't just a collection of separate parts in a bag. It's one deeply interconnected system. So some inflammation in your jaw doesn't just stay in your jaw. No way. It can send signals out and create effects through your entire body, popping up as pain in places that seem totally unrelated.
So let's explore this hidden network. And remember, this isn't just one person's theory. It's a point of view that's getting more and more support from modern science, which increasingly sees health and sickness as a whole system problem.
In fact, there's even a formal name for it, the biopsychosocial model. All that really means is that science now confirms that pain is never just about damage to your tissues. It's a complex experience that's woven together from our biology, our psychology, our thoughts and emotions, and even our social world. It's the whole shebang.
And the fallout from chronic pain creates these huge ripples. It doesn't just hit one muscle or one joint. It messes with your sleep, it can tank your mood, it can even put a real strain on your relationships. It systematically takes apart your quality of life.
Now here's where things get even tougher, because all those ripple effects, they don't just happen because of the pain. They can actually circle back around and make the pain itself feel even worse. It's a real downward spiral.
So this is the vicious cycle. It all starts with the pain itself. That pain, of course, destroys your sleep. Then, a lack of sleep leads to emotional distress, anxiety. I mean, who wouldn't feel that way? But here's the kicker. That distress actually rewires your brain to be more sensitive to pain signals. So each step just fuels the next one. It's an incredibly tough cycle to break out of.
And this is exactly why Perl is so direct with people. A problem that's been building for months, maybe years, and is locked in by this powerful feedback loop, well, it's not just going to disappear with a quick fix. It takes a real, committed, patient strategy. So if the problem is this complicated, what does the solution even look like? Well, a practitioner like Perl needs a much deeper toolbox, one with specialized tools that are actually designed to get involved in this complex system.
For instance, she often uses something called electroacupuncture. This is not the same as standard acupuncture. Here, a very mild electrical current is added to the needles. And what that does is it activates really specific anti-inflammatory pathways. It's a high-precision tool that's especially good for the kind of widespread, sensitized pain we see in chronic conditions.
But the tools don't stop there. Perl is also certified in sports medicine. Now, this is huge because it means she can bridge the gap between Eastern ideas, like meridian pathways, and Western biomechanics, the science of how the body is supposed to move. She speaks both languages fluently.
And just how rare is that combination? Well, in the entire state of Massachusetts, there are only about 6 people who have this specific dual certification. That really highlights just how specialized this level of care truly is.
Okay, so let's pull all this together. The real path to relief isn't about hunting for a magic bullet. It's about shifting our entire approach, moving away from demanding a quick fix and toward committing to a deep, patient investigation of the problem. So ultimately, a truly effective strategy has to look at everything. It starts with that full system review, and yes, that includes your teeth. It acknowledges the mental and emotional weight of pain. It sets honest timelines, and it uses a combination of advanced tools to hit the problem from multiple angles.
And that is our main takeaway here. You just can't fight a chronic, complex, system-wide problem with a short-term, simple, localized solution. The strategy has to match the challenge. It has to be patient, intelligent, and it has to be comprehensive.
And that kind of leaves us with one last thought.
We are so often focused on just making the pain stop. But what if the real path to relief actually begins when we shift our goal? When we stop trying to just fix the pain and start trying to finally truly understand it.
I stopped trying to find a doctor who would listen, and I did this instead. For years, I was doing everything right. Eating clean, exercising, getting 8 hours of sleep, but I was still exhausted. I had constant brain fog and my hormones felt completely out of whack. Every doctor told me my labs were normal and it was probably just stress. I was about to give up until I found Holistic Health. It's a free AI wellness tool trained by functional medicine experts. I spent 5 minutes answering questions about everything. My symptoms, my sleep, my digestion, and it built me this. And this was the light bulb moment. It didn't just give me a list of problems, it connected the dots. It showed me how my gut health was likely impacting my hormones and how that was causing the fatigue and the brain fog. It even gave me a clear list of potential root causes, supplements to research, and even the specific lab tests to ask for. Its tip is secure. Over 77,000 people have used it, and it's 100% free to get your blueprint. If you feel like you're not being heard, start here. Understand your body first and then decide your next step.